A lot of our work has traditionally been in foot orthoses, so looking at what their clinical effects are, whether they can actually reduce pain in people with patellofemoral pain or patellofemoral osteoarthritis, and they certainly show some benefit there. What it doesn't quite match up with is the proposed biomechanical effects at the knee. So we see some biomechanical changes at the foot and ankle, as you would expect with a foot targeted intervention, but we don't necessarily see the biomechanical changes happening at the knee that we think could explain why people get a reduction in their pain. And so there are other interventions that we're exploring now, so particularly things like minimal shoes or flat flexible shoes that tend to or have been shown to actually have a direct impact on the patellofemoral joint in terms of reducing the force. Also show some promise in terms of being able to improve pain in people with patellofemoral pain and osteoarthritis. And so we're starting to explore that further with our pilot work and then hopefully into some full-scale trials down the track. I think just the ability for people with kneecap pain, whether they're an adolescent or an adult with osteoarthritic changes in their joint, just to be able to find a simple intervention that they can use, they can incorporate into their daily life without having to think about it, without having to spend too much money, without having to go to multiple appointments, but actually be able to improve their pain and their symptoms and therefore their participation in life.